I'm Mariah.
And I'm Gabby.
Today we're going to be going over surgical hand scrub, putting on a surgical gown, assisted gloving, placing and removal, and closed gloving. Remove any jewelry and don a surgical cap and mask, ensuring that your hair is contained. Using non-sterile soap and water for 1 to 2 minutes, lather and interlace your fingers, completely washing your hands and arms up to 2 inches above your elbows. Once complete with the non-sterile wash, you may use a non-sterile surgical huck towel to dry your arms. Discard the towel on the floor when done. Check the integrity of the pack and verify that the pack has gone through the proper sterilization process. Open the outer pack by pulling up on each of the corners, being careful not to cross into the sterile field. Only handle the outer wrap by the corners and open the sterile pack containing the towel and gown. Prior to scrubbing, you also want to make sure that your sterile gloves are open, as well as your brush pack, exposing the nail pick while keeping the brush contained. Be careful not to contaminate. Start your sterile scrub by inspecting the integrity of your hands and arms, turning on the water and adjusting the temperature. Wet your hands and arms and apply the sterile soap and lather with your hands up to 2 inches above your elbows. Do not rinse it off yet. Using the nail pick, clean thoroughly underneath your fingernails and discard the nail pick in the sink. Start scrubbing by working in the order of fingers, fingers, hands, arms. Imagine that your fingers are divided into 4 flat surfaces. Scrub each surface 10 times and follow the same procedure with your hands and arms. Do not touch any part of the sink or faucet with the scrubbed skin surface. Drop the sponge in the sink and rinse off starting from the tips of the fingers moving down to the forearm. Water should be turned off with the knee lever or by an assistant. Do not touch the faucet. Once scrubbing is complete, you can proceed to the location for gloving. Using the 4-quadrant technique, grab your sterile huck towel to dry your hands and arms. Don your surgical gown by grabbing the gown from the pack at the top of the neckline and letting the accordion fold fall downward. Do not shake the gown open. Slide your hands and arms into the holes, which should already be facing you, with the inside surface of the gown towards you. Do not expose your hands towards the sleeves cuffs and do not drop your arms below your waist. Have an assistant help you tie the back. Close gloving is done with your hands inside of your cuffs. Grasp the inside of the glove and pull it over the cuffed hand, pushing your fingers through the glove, being careful not to contaminate any sterile surfaces of the glove. Repeat the same step with your left hand. Be aware that since your right hand is now sterile, some alterations will need to be made in where you grasp the glove for placement. The assistant will begin by picking up the right glove underneath the cuff, being careful not to touch any non-sterile surfaces. Hold the palm of the glove towards the person being gloved and stretch the cuff open. For assisted removal, the assistant will grab the top and bottom of the cuff and stretch the glove open. And that completes our video on these surgical techniques. Thanks for watching.